our financial resources for health expenditures consist of the three factors: tax money, co-payments, and premiums. But always the premiums that gave us the financial resources. Approximately more than 75% of our health expenditures come from these source of the premium. And secondly, the socially vulnerable people are covered by public livelihood assistance, and that does not require out-of-pocket payment. So we could successfully separate the prepayment system through our universal insurance system and the public livelihood assistance, in which we can deliver the health services without any burden of the patient. And thirdly, healthcare services are delivered by private and public hospitals and clinics. The private hospitals composing 80% of the facilities and 60% of beds. And health insurance plans were not consolidated. Still now, we have 3,500 insurance plans. This is a real headache of us, but we did not change it. And instead, physical equalization grant was introduced to adjust disparities among the plans. This system was introduced in the middle of 1980s. And universal health coverage was introduced as a part of the comprehensive policy package to develop the middle class population and contributing to the establishment of a safe and healthy society. And timing is very important when we should introduce universal health coverage. Universal health coverage was introduced before the economic growth and population birth. This is very important for Asian friends. The speed of aging in Asian friends are very fast. And unfortunately, the Asian friends cannot have the longer time under the economic bonus, population bonus. Therefore, within a short period, you have to prepare for aging society. This means that you should be prepared for universal health coverage as fast as possible. Now, the effect of Japan's universal health coverage, as I mentioned, of course, improvement in life expectancy through measures against the chronic diseases. And second, effect on income redistribution. As I mentioned, 70% of government mechanism of the distribution came from universal health insurance at that time. An effect on the household budgets, prevention of household bankruptcy caused by the burden of out-of-pocket payments for medical costs. An effect on nurturing the spirit of solidarity. This spirit of solidarity is the basis to keep mind to consistently commit on this universal health coverage. And now, finally, I'd like to mention the effects on stabilizing society and politics. As I mentioned, universal health coverage shared a very important role, not only to strengthen the basis of the health conditions, but also to contain the widening gap between rich and poor. Therefore, the health expenditures for universal health coverage means not only the economical consumption. This means the investing in health, and also this is investing in social safety and even political safety. And this is the interesting process and trends in the life expectancy at birth. The look at the 1945. it's amazing things. The life expectancy for male was only 50 years old at that time, and female 54 years old. But in 2008, the life expectancy for male became 78 years old, and female 86 years old. Maybe within the foreseeable future, the both become no more than 19 years old. But important thing is that the first period before the middle 1960s, the major reasons why we could extend life expectancies came from the controlling the mortality rates of the newborn baby, and also contained the mortality rates of the maternal health, and contained rates of death closely related to the infectious diseases such as the tuberculosis. Those reasons are now the plenty of reasons which are suffered in the many low-income countries. We had the same problem at that time, but we could overcome it within a very short period. But what I would like to emphasize is that after that, we could consistently extend our life expectancies in 1970s and 80s and 90s. Why we could do that? This is the trend in the probability of death at age 15 to 60 years in Japan and selected countries during 1950s to 2008. It is obvious that this graph shows the rapid decline in the probability of death at age 15 to 60. Why we could do that? This is totally dependent upon the role of universal health coverage, which had a wonderful function to contain those the cause of death closely related to the infectious diseases. This is a very interesting graph. I like this graph very much indeed. Trends in men's mortality due to the stroke in Japan and selected countries. Look at the red line shows the Japanese rates. They're very high, very, very high. But in 1960s and 1970s, we could successfully decline this mortality rates due to the stroke. The study was originated by the Lancet Japan series, which Mr. Tsuchiya mentioned. I was a chairperson for the steering committee for Japan Lancet series at the time. And also I joined several teams and comment on those analysis of reports. When we started to analyze the reason of the trends of the mortality due to the stroke, we thought that maybe this major reason came from the public health approach, which means that the government mobilized so many resources to educate our people who enjoy have a very salty taste foods, especially in the east and northern part of Japan. However, actual data which could have as a result of our research was totally different. This graph shows the contributing factors of controlling blood pressure. As you know, 80% of the people who unfortunately died because cause of stroke were the patients of high blood pressure. So how we can control the blood pressure is closely related to the cause of the death of stroke. The white bar is the effect of medication. In other words, the people gain access to antihypertensive drugs in Japan thanks to universal health coverage. This can be a wonderful fact for the person who works for the pharmaceutical corporation, I think. You know, why this sort of things happen? Because we could have the wonderful function of universal health coverage. So those are the people who had the high blood pressure could very easily to access to those are the clinics and had the suitable diagnosis and gave those are the, the medical drugs for those in order to control their own blood pressure. And consistently those patients could enjoy, have those are the suitable medical treatment with those are the medical drug treatment. This means to contain the death caused by the stroke in our country. This is the only these things extended 1.2 years for our life expectancy. Now, I entered into the subject of legal framework of our healthcare system. Before World War II, Japan introduced employment-based health insurance and community-based health insurance in order to increase wealth and military power with a healthy population. Imperial government wanted to have healthy soldiers, healthy workforces, and healthy mother. So the first phase of our introduction of the universal health coverage focused on employment-based the health insurance. And then the community-based insurance came up through those the municipalities. And in 1938, finally government adopted this the community-based insurance system in our own country. But it was amazing things that even during the war in 1943, the public health insurance could cover 70% of our people already. That's the reason why we could relatively and successfully achieve the universal health coverage in 1961. Well, after the war, under the democratic constitution, we looked for the nation's scheme to be more social welfare state. And then we designed the health insurance scheme under the National Health Insurance Law. This time, priority was changed from the employment-based health insurance. Now, the community-based insurance was given a priority. As the exception of this, the National Health Insurance Law, the employment-based insurance could survive and could exist. This is a very original but important legal framework we have. So within the future, maybe we have to consolidate our plenty of the insurance plans. At that time, I'm quite sure that the community-based